Hello and welcome to our Doc Talk. We've had a bit of a hiatus due to the fires, but we're back. And with us is Chief Medical Officer Seth Kaufman, and we're talking about the latest on COVID-19.
Good morning, everybody. It has been some time since we met, and we've done one of these sessions. A reminder that we are doing these every 2 weeks. We're back into the routine. It's been a very challenging few weeks with the fires, but everyone's doing okay, and we hope you're safe and healthy. From an introduction today, we're going to run the numbers, which we do during most of our sessions at the beginning, and then we're going to go right into your questions. So with the numbers, I'll start with Solano County, and then I'll talk a little about Northbay. And the data I have is available to you on the Solano County Public Health website, and I'm going to add in a few numbers to it. As of yesterday at 4:30, the last time that the Solano County Public Health our Solano County Public Health Department updated their data, we had 5,588 confirmed cases. That's a 7-day positivity rate of 7.1. There's currently 30 hospitalized patients in Solano County. That's a drop from what we've had in the last few months, and a total death rate of 47. That total death rate is about 0.85% of our population. So 0.85%. That's a very, very good low death rate. Of course, anyone who dies from this is devastating. But overall, in terms of how we compare to other counties and overall how we compare to the state, that is a very good number. All those numbers, overall, we have seen an improvement. Here at Northbay also, we've seen a drop in our hospitalized patients. We have less patients in the ICU than we had perhaps a month ago. And so overall, we're really encouraged. We're really encouraged by that right now. If you're following the state data too, overall seeing some improvements. Why is that, you might ask? It's hard to know. I wish I knew exactly why. Are we all being very compliant with our mask wearing, social distancing? Did all the air quality issues, smoke issues, fire issues pull us back inside to our homes and protect us from getting COVID? It's really hard to know. I want to think that a lot of it is our improved compliance with these very standard now and known to be effective transmission precautions, social distancing, hand hygiene, and mask wearing. Okay, with that, I want to just give you a few other piece of information, a few other updates. I would say the two major updates in the last few weeks since the last time we did the session is one is that Governor Newsom released a new county risk level category system in the last few weeks, and we are in the purple. My daughters love the color purple. I wish I could associate purple with something positive. I wish it was a different color, but it's purple. Solano County's in the purple, which represents kind of widespread COVID prevalence. And that is pretty similar to almost every county in the state. So something like 80%, I'm guessing that. But if you look at the state map, you'll see that that we are in the purple with almost everybody else. We are heading towards red, the next level down, with some of our numbers. The two big numbers for now that our state is looking at is the positivity rate. So the number of positive patients, the number of positive tests we have. Our own county data is 7.1%. If we're under 8 for several weeks, 2 weeks consecutively, then we were eligible to drop to a red, which allows us to open more businesses, essentially loosens restrictions on reopening. The other criteria that is being considered, the other major metric is case rate. So this is the number of cases we have per 100,000. We need to be about, on a daily basis, we have to have about 32 cases or less to be considered for red. We are over that right now by about 25% on average. If you look at the state website, versus our county website, the numbers look a little different. The way we input our data into the state, Northbay, Kaiser, Sutter, our county, everybody, we put it into a state data website, and so in terms of the time frame and often, depending on when the test comes back, the data could be a little different on our county website versus our kind of the numbers you see if you're looking at those state website numbers. Okay, so we are in the purple. By the way, examples are, we're actually allowed to have indoor salons open with 25% capacity. As an example, indoor malls are opening with 25% capacity. Elementary school waivers to allow on-site learning is allowed in purple. So purple is not complete shelter in place. It allows for some safe reopening of businesses. And then, of course, as you go from red to orange to yellow, it allows more and more to open. Okay. So with that, we're going to go into your questions. I do want to say two other things. One other update to note is that we all see the news. We know that the CDC put out some very controversial statements around whether there's value in testing those without symptoms. So they say there was a statement made that perhaps there's not a lot of value, or we shouldn't be testing those who are asymptomatic. Solano County, that doesn't change anything in Solano County. Our county health officer has said that. Our Optum-serve state sites that do test those who are asymptomatic will continue to test those that are asymptomatic. We are testing those with any potential exposure, especially the ones at high risk, older people, those who are immunocompromised. So I want Solano County to know, our own North Bay community to know that these CDC statements do not result in any changes in how we test our community. If you are concerned you've been exposed or you have any symptoms, we should test you. North Bay, our urgent care does testing. You can reach out to your primary care doctor and do virtual visits. And these Optum-serve state websites, these state sites have openings, and they have not some months, but they have. Whether it's because of the air quality or because of these statements from the CDC, they have had less people showing up to be tested. So if you are concerned, go and get tested. Okay. With that, Robin, what kind of questions do we have for today?
Well, the mortality rates of COVID have been making headlines a lot too. So I guess the question is, how reliable are the numbers that we see? So, for instance, they said fewer people died just of COVID. Most people who die have underlying conditions. So how are we supposed to interpret that?
Correct. That's a really good question. I'm gonna repeat it to our audience here. How are we identifying whether somebody's died of COVID versus they've died of, let's call it, natural causes? We don't use that term very often in medicine. There's always a cause, but if they died of a stroke but they were COVID positive, or died of a heart attack and they were COVID positive, is that counting as COVID? It's true. There could be differences between states and areas. It's really hard to know. Overall, I do think that the mortality numbers that we're seeing are reliable. It is not, there are questionable cases here and there, but most of the time we can tell whether someone's died of COVID. A reminder that the final common pathway for COVID patients that are getting very, very sick is that we can't oxygenate them. Their oxygen levels are too low. So of course that can trigger, your brain needs oxygen, your heart needs oxygen, your entire body needs oxygen. So if you die of a heart attack, it still can easily and likely is from COVID if you had COVID in your lungs. So I hope that makes sense. Essentially, it's kind of, the question you're asking is, which came first, the heart attack that killed the person, or COVID? And most of the time it's fairly obvious. I think, at least in the United States and in our area, the mortality data is fairly accurate.
Okay. Great, thank you. Who's most at risk for developing severe problems with COVID? Is it mostly those with underlying conditions? And why should those of us who don't have underlying conditions be concerned and cautious?
Sure. So COVID affects everybody. It is well known that that more advanced age, older people can have more severe disease on average, and those who are immunocompromised. Patients being treated for cancer patients, diabetes, people on medicines that suppress their immune system is just some examples. But if you look at the demographic data in Solano County, and you look at the demographic data in almost any area, we see a lot of younger people, let's say 30 to 50, who have COVID and get sick from COVID. Some of that is because our older populations on average are much more careful. They're staying home more. We have senior only hours of the market, things like that. We're being very protective of that group, and they're just getting it less. In Solano County, something like 9%. 9%. I'm going to look down on my computer here to make sure I'm giving you exact numbers, but something around 9% of the positive tests in Solano County are elderly, and something like, looking right now, 61% between those 18 and 49 make up of our positive patients. 61% are between 18 and 49. Over half are in that middle age group and younger, and that's because honestly, that those age groups on average are less careful, having more social interactions, taking off their mask. That is what we see when we do our contact tracing. On that note, the contact investigations, when there's a positive case, NorthBay does some of this, other hospital systems do too, and our county has a full contact investigation program. What they see is 95% of those that are positive are getting it from family, friends, close interactions. We know the majority of that is non-compliance with the transmission precautions. That isn't. That's not a. I'm not trying to punish anyone who's done this. It's very hard. If you're in a household, I can relate, and you can relate to this. Anyone who's watching, it's really hard to stay distance. If you turn out to be positive and you're in your home, you're told to isolate. Oh my gosh, that's really hard. How big is your house? Do you have a room you can do it in? How are you going to eat? So we know it's really challenging, but it's good information for you to know that the majority of transmissions occurring in close contacts, whether it's work, friends, family in the household. So that's what we're seeing, and that's more. There's more younger people that have that happen than older, and so we definitely in our ICU have younger people. I got to tell you, and in every ICU in this country and the world, there are people who are under 50 years old, under 40 years old, here and there. They do get sick. They just get sick less than older people. So everyone needs to be taking this seriously.
Okay. Now, we had the recent fires, and the smoke inhalation kind of can be confused with COVID's cough, and we're heading into flu season now too.
Yep.
So are we seeing more people coming in thinking they have it, but really it's just that the flu, or how is a person supposed to know? Should they come in? Is it flu? Is it?
It is the question of the month, Robin. So I am getting the question here and there. Dr. Kaufman, here's my cough. Is it the smoke? Is it flu, or is it COVID? That is a tough question. I'm going to start by just saying that I think the last month has been very challenging. And a few months ago, I probably sat on this screen and said, gosh, the last few months have been kind of challenging. Things are just getting tougher. The air quality issues and the smoke combined with COVID is a challenge I didn't think we were going to have to face this year. We knew we were going to have fires at some point, but this early on, I had hopes that maybe COVID would be more under control before we had air quality issues. The thought that we are telling people, hey, as I just said, family transmission and in close quarters transmission in indoors is a concern. You should try to be outdoors. But in the same breath, we're saying, you can't be outdoors. The smoke is bad. The air quality is bad. Go back indoors. I mean, you just can't win. It's really hard right now, and I would just tell you to stay as positive as you can. With that, I'm going to tell you that it's really not possible to tell those three apart. It just isn't. When it comes to the cough, it's just not. I mean, you may know. You may have gone outside and you have this. It's the context, right? So I went outside. I felt bad from the smoke. The air quality was bad that day. I looked online. I saw what the air quality is, and I went back inside and I felt better. I mean, there's obviously some temporal relationship, context that helps us decipher. Obviously, you don't get a fever from smoke. So there's other symptoms that we look for, and there's context. That's about it. There's no data, no studies that tell me, the sound of the cough, how deep it is. Some people you're often asked by your doctor, the color of your mucus. A lot of data doesn't show that the color of mucus means much. We like to still know. We put it into the context of the whole picture, but producing, honestly, if you get smoke into your lungs, your body's producing mucus to try to get everything out. So people can have productive coughs where they're coughing up something, or dry coughs. It's really hard to tell them apart. So what's the solution? Look at the whole clinical picture, reach out to your doctor if the cough persists, and get tested. I'm hoping in the coming month, that's being a little aggressive, but coming month, we'll have some more options for rapid tests that allow you just to be tested at a very affordable price pretty quickly. It may not be as good as the test that takes a week, but gosh, which is better? To wait a week for a test to come back when you're not even contagious anymore, or have a test that you can do maybe 3 days in a row, and maybe it's not as good, but if all three are negative, like you don't have it, then you probably don't have it. So more to come on that. Maybe you're reading a little bit online about these rapid tests, but they are being released at a very rapid pace. And I think that's the next step, is that you maybe, when you are questioning smoke or flu or COVID, you will be able to quick rapid test that's back in 10 minutes or an hour and move on with your day.
Right. Now, you talked earlier about things opening up again. Is there concern that as things start to open up, we're going to see another spike like we did last time?
Yeah. The question is as things reopen up again, am I concerned? Is the medical community concerned that we're going to see a spike? And the answer is yes. We're also concerned as we enter the winter season whether we'll see a rise in cases, period, because we see more things in winter. A lot of that is because we're forced to be in closer quarters in winter. The answer is yes. We have concerns around that. I will tell you that that I really believe that social distancing and mask wearing and hand hygiene really work. So if we can be very careful in these environments, then we probably won't see the spike that I'm fearful of. But yes, that is a concern.
Okay. There have been a lot of testing issues in the news. Can you explain why some test results take a week and others are back in a day or two?
Yeah, I could probably talk about that for an hour, which is way too long for this talk. We could spend more time on that in the next 2 weeks. We can spend a little time every session about testing. There's a lot of different mechanisms for these tests. There's also, for some testing centers, they are impacted and some are not. So most of the formal tests that get sent somewhere to a big lab with a big machine are gold standard PCR tests. To run those tests, the time they're on the machine is 6, 8, 10 hours. And I'm approximating, by the way, if you're a lab person and you're off by an hour, then I'm off by an hour. I don't work in a lab, but I know. So 6, 8, 10 hours at the longest. Some are 5 hours. Then these are the PCR, what we call the gold standard, the tests we're using to compare to all other tests. So the tests on the machine don't take a week, but there's only so many slots on the machine. They wait in line with everybody, with all the other tests. So when it takes a week, it's because it's getting sent somewhere, which takes time. There's cutoff times for these to land in the lab. Then there might be however many tests that center can run in a day. That's all they can do. And I will tell you, our labs, our academic facilities like UCSF have done an amazing job creating capacity for testing. Then you have these rapid tests. They don't compare in terms of accuracy to the PCR test. They approach it, but they don't. We know some are worse than others. So that's the tension, is do we wait for a better test, but it takes longer because it's a bigger machine and it takes longer to run everything and there's only so many slots in our country? Or do we disseminate these less effective tests, less sensitive tests, but they can be back in 15 minutes. Some you can do at home. Some you can do in a clinic. And so more to come on that. I am moving towards, I think, what a lot of medical professionals, in terms of their views, are moving towards, which is it's better to have rapid tests that come back quickly while you're possibly still contagious, even if it means that it may be wrong here and there. And that's maybe frustrating to hear, but a lot of these rapid tests that are wrong, you're probably not that contagious if it's wrong. Maybe not, but the thought is that some of these tests, when they're negative, but you really have the virus, maybe you don't have that much and you're not that contagious. Also, it allows us to do serial testing. Maybe if the test is $5 or $10, like what Abbott just put out in the last week and got EUA approved, tests where it's a cardboard kit where you put the swab and you fold the cardboard over and you wait 15 minutes. If you can do that every day for 3 to 5 days, is it as good as sending one test to a lab for a week? So that's the kind of stuff that we have to think about as a medical community. And I answered that. That was too long of an answer.
All right.
Too long of an answer.
Well, we have a question from Janet, and thank you, Janet, for tuning in. She's curious to know what you think about schools reopening, like should they and when should they? And
yeah, I've said it many times in the sessions. I have 2 children. One is 10 years old. One just turned 13. If you have any advice on what to do with my 13-year-old, please help me. I now have a teenager. So I can relate for sure. Both my kids are in full distance learning programs in public school. So the problem is that there's 2 things to discuss. One is, we know that elementary school age and younger, and it depends on when we use that age cutoff for elementary school, have less chance of transmitting the disease, and we know those kids get less ill. Once you reach middle school, it looks like the data is showing that they transmit as much, they can pass around the illness as much as any adult can. That's what it looks like. It's weak evidence. It's not all there yet, but that's the growing consensus. So I do believe that the current risk, county risk categories that were just put out by Governor Newsom that uses case rates and positivity rates is the right way to go. If the disease prevalence is high, as it is in our county right now, then the chance that kids are going to pass it around at school and bring it home is higher. So that's comment number 1. So I'm supportive of distance learning right now until we get down to a level of transmission that's low enough where the risk that we have outbreaks at school is low. So I hope that's kind of clear. Also, I want you to think about something that I've read and heard from teachers and others, is that we're imagining that if kids go back to school, that it's going to be like normal times. Like I know I imagine that, maybe because I'm hopeful, but like, oh, I want my kid to be back on there learning normal social rules, because that's what you need on-site school. Now they're going to be on the playground. They're going to learn stuff. They can be with their friends. That's not how it would be if we opened it up today. And for those of you who do have some sort of on-site learning can probably relate to this. Kids have to be distanced. Teachers who are going to be appropriately anxious about getting the illness or passing it around are going to have very strict rules. So when that one kid kind of gets too close to somebody, that teacher's going to be like, nope, please get back in your seat. Get back, keep your hands to yourself. It's going to be stressful. It's going to be anxiety provoking. There's not going to be a playground where kids are jumping around and wrestling and playing games. It's going to be this, are we really going to be able to have a normal school if we opened it up? And the answer is pretty much no right now. So I think distance learning is the way to go, and optimizing distance learning. Otherwise, if you have, a closed loop with friends, they can play in the backyard. And I think we have to wait for rates to get lower before we reopen schools.
Great. Thank you so much. Can we talk about some of the treatments that we're seeing and advances in treatment?
Sure, we can talk about some of the treatments we're seeing. The big 3 right now that we use here at NorthBay, and I would say every health system is using right now, all of them, like a lot of things in this pandemic, there's not huge studies really supporting any of these, but we do feel they're safe. One is remdesivir. So remdesivir is an antiviral medication, and we continue to feel here at NorthBay that we are seeing benefit from that medication. The next is dexamethasone. It's a steroid. Not surprising, it's been shown to have benefit in those who are on oxygen. So that means hospital-based patients. Same with remdesivir. And then lastly is convalescent serum. Probably the most controversial in terms of studies right now. There are some Mayo studies showing that has benefit in certain populations, those who are not intubated. So that means those who don't have a tube and are on a machine. But it also can be one of the safest. It is a blood product. We screen very carefully for blood products. You can have a reaction to blood products, but it's on the rare side. So remdesivir has a lot of side effects too. Steroids have side effects also. So everything in medicine has a benefit, and there's always risk. Always risk. Those are the three we're using right now. We believe in all three right now until the studies show otherwise. NorthBay, like other systems, we're really following the guidance from the CDC, following the medical journals. I watch them very closely. My infectious disease colleagues do. Our intensive care unit physicians do. We all do. And we, just so you understand how things work in most health systems, including ours, we talk about it daily. We talk every day. What's going on? Does it support what we're doing? We want to make sure we're helping patients and not hurting them. So these are the three big medications. All have really shown benefit in hospital patients at this stage. There is some recent data on whether remdesivir can be used on patients who are not on oxygen. Keep in mind it's an IV medication. There's no pill form. I think that this was an open label study. I think it still needs more analysis before we would change practice. And dexamethasone is a pill, can be a pill, but it's really only been shown benefit in those on oxygen. And blood products, you can't just give blood products to anyone. It takes time to get it. You have to be matched. Your blood type has to be matched to the plasma for convalescent serum. And so I guess what I'm trying to say is that as an ER doctor who sends patients home with COVID, I would love to have something to offer, a medicine, but these treatments are for hospital-based patients, those who are so sick they need to be admitted to the hospital.
Okay. Well, we have a question from Lindsay. Let's see if I can see all of this on my screen. It says, are there any studies currently underway regarding pharmacological treatments for mild or moderate COVID patients?
There are.
Just like who are recovering at home?
Yes. So that's a great question. That's actually a perfect question, right? So I started talking about that at the end of this last question about the different treatment options is, hey, is there going to be an option for people who are not sick enough to be admitted to the hospital? There are studies all over the place looking for some sort of oral medication that can be provided. So the most recent one was that I'm aware of is dexamethasone, so a steroid. It actually showed a little bit of harm, like it made people actually not only didn't do better, but might have done a little worse on those who didn't require oxygen. So that would be a population that maybe can go home. A lot of the time we're admitting people to the hospital because they need oxygen. So I know those studies are out there and I'm watching them closely. Remember hydrochloroquine was another example. And actually it's an example of that it got sped through so quickly and we started using it, and then it wasn't until later that the studies came out showing that it doesn't help at all. So we have to really be patient waiting for the magic pill, which is what you're asking for. Keep in mind that it's not just about whether the person can get better who's safe to go home, but also are there medicines out there that we can give to people who can go home that would decrease their transmission risk? That would be outside of a vaccine. So that would be really, really, really invaluable. If we could say, hey, you're safe to go home, but here's a 5-day supply of a medication. But what we know now is that there's less chance you're going to spread it around unknowingly. So I want to see that happen too, and those studies are absolutely out there.
Okay. With flu season coming, does getting the flu shot help with COVID? Or do we know yet?
The flu shot will help with flu. And it's going to be hard to tell flu from COVID. Here at NorthBay, we are evaluating options to be able to test for flu and COVID at the same time. Not the same test. It's a completely different illness, and different etiology. It's a different virus. But we are setting up a plan so we can test people in the clinic, people in the hospital for both flu and COVID right away, because we won't be able to tell one from the other. But flu vaccine does not help with COVID. It won't help with COVID. So does that mean I should get a flu vaccine? Yes. you're not going to be able to tell either. So let's just not get you sick, right? Let's just get the vaccine, and there's a good chance then you won't get sick from flu, and then you probably won't get sick at all, right? Versus you don't get the vaccine, then you get a cough. Now you're like, is it COVID or flu? Now I got to go to a clinic or call my doctor or go to one of the state sites and get tested. You don't want that. Get the flu vaccine. It's very effective most years. It will be effective this year. I'm feeling good about it. And that way, maybe you won't get a cough at all the entire season, and you won't even worry if you have COVID.
All right, we're almost out of time, but I don't want to end any of these chats without talking about how safe it is to go see your doctor and come into our facilities. You don't want to delay care. So
nothing has changed at NorthBay in terms of our safety levels. So we are very safe. You can come to our clinics, although we are trying to do as many virtual evaluations as we can. It's better for you, honestly. So we can always start with a virtual evaluation. Then if you need testing or things like that, we have options for that. The emergency department, our hospital, we have dedicated COVID units. As I told you, things are getting a lot better right now. I hope to be able to say that again in 2 weeks. But we don't have, but we continue to keep our patients with COVID in isolated units, so they are away from others. We have good PPE. You will see that if you need to come to our hospital. We screen all our visitors when they come to our hospitals. We are monitoring our employees, our staff. We have a robust process to get our staff tested if they need to be tested and to monitor them. So we are safe here, and you should feel safe coming here. You should be safe coming here. I do want to say one other thing before we close, and then we'll have to say goodbye. This is getting long. One of the biggest issues right now is mental health. There was just a recent study out of JAMA showing that the rates of depression are 3 times higher right now than they were pre-pandemic. So I really want to, we have an epidemic of COVID, a pandemic of COVID. The air quality is bad. We also have a pandemic of depression and anxiety. So I have a challenge for you. So 2 things. First is, I want you to be mindful of what you can manage. It's very human for people to think the worst, to look around and say, everything's bad, and then to try to take control of things they don't have control over. So first challenge is, I want you to think about what you have control over, because you can't do anything about the things you don't have control over. Unless you're a firefighter watching right now, or maybe some other people, you can't affect the air quality. You can't affect their air quality. So what can you do in your own environment to keep yourself healthy, as an example? The second thing I want you to do is take a few minutes today to think of something positive. Do something that makes you feel good. Stop and live in the moment. So find something, whether it's being with your family, something you can do that gives you joy, and spend a few minutes today doing that. If we all do that and we start just trying to manage the things we can handle, put things in perspective, then hopefully we can get through this together and improve our mental health. Our next session is in 2 weeks. That'll be Thursday, September 17th, 10 a.m. We'll answer your questions. We'll talk about testing. I'm happy to also, I'll make sure, and I'll be, I do anyways, that I'll be reviewing the latest studies on possible treatments, and I'll come in and talk to you about that. So meet us here, 10 a.m., Thursday, September 17th. Thank you so much.
Thank you, Dr. Kaufman.